good, bro.
Do you need any help? Can you stand on your own?
I think it might be a fracture.
There are many different kinds of bone fractures and all of them need medical help. You cannot treat a broken bone by yourself. However, first aid is still important. Treating a victim at the beginning means a better recovery at later. Determining an injury, if it's a fracture, dislocation, sprain or strain, is very difficult. If in doubt, always treat it as a fracture.
Look at the brain. Your fracture is sometimes very clear. For example, with a broken wrist, you may be able to see that bones do not align normally. Sometimes the bone even breaks through the skin. Even when a break is not clear, there's a bleeding wound, cover it with a sterile cloth or bandage, then press on it lightly. Sometimes the sharp pieces of bone fragments can also cut and damage soft muscles and nerves. This makes it much more difficult for the injury to heal. To support the injury, use a splint. A splint can be anything hard and long. For example, you could use a piece of cardboard from a box or any smooth piece of wood. For an arm or wrist fracture, you can also use a sling. A sling is a piece of cloth. It is sharp like a triangle. You can also use ice so that the injury area does not swell and get larger. Do not put ice directly onto the skin. Instead, place it in a clean cloth and put the cloth on the skin.
Finally, there are a few things you should never do. Do not encourage the victim to move the injured area to find out if it's broken or not. This can cause more damage. Do not rub the area around the break. This could cause more damage to the bones. And do not move the person without the support of a splint. And do not give victim any food or anything to eat. If he does need an operation, this can cause problems.
Fracture is a break in your bone, which can also be called as broken bones. We call these broken bones as bone fragments. Damage close to a simple fracture is when the bone breaks but not pierces through the skin. However, open or compound fracture is when the bone protrudes through the skin and have increased risk of infection and requires extreme repositioning. Both need separate treatment approaches. A green stick fracture is an incomplete or partial fracture where the bone bends and cracks either one side or partially. It is more common in children and adults with weak bone density. Impacted fracture is when the parts are crushed together. Displaced fractures are tricky to treat because they require the bone to be reset before it can heal. Comminuted fractures are very complicated because the bone is split into 3 or more pieces.
Hello station, your test reports have just arrived. It appears that your fracture bone is slightly displaced.
Is it too serious, doctor? When can I work normally?
Proper medication and rehabilitation practices, you will be alright within 5 to 6 months.
Refers to the practice of gently pulling a fractured or dislocated body part for providing temporary immediate relief after the trauma and also guide the body part back into the place. It also involves using ropes, pulleys or weights to pull broken or strained body parts slowly. These tools help to apply forces to tissues surrounding the damaged area.
Casting is a common method used for immobilizing and supporting the healing process of fractured bones. It ensures proper alignment of the bone fragments and restricts movement, which is essential for healing. Then we have open reduction, which is surgical procedure used to realign and stabilize fractured bones. This method is typically required for more severe displaced fractures. Then internal fixation, which is a surgical procedure used in bone fracture treatment to stabilize and secure broken bones with the help of various implants such as plates, screws, rods and wires. This method is commonly employed for fractures that cannot heal adequately with just external support like casting or splinting. By holding the bone fragments in place, internal fixation allows for proper healing and early mobilization. Arthroplasty. If case you fracture a joint, your surgeon will remove the damaged joint and replace it with an artificial one called prosthesis. It can be metal, ceramic or heavy-duty plastic.
A splint is a device that supports and protects a broken bone or injured tissue, also known as a brace or arthritis. It helps reduce pain and promote healing by keeping the injured part of your body still. External fixation is a surgical procedure used to stabilize and support fractured bone or dislocated joint by placing a rigid frame outside the body, connected to the affected area with the pins or screws. This allows the bone to heal in proper alignment while providing stability and preventing further damage.
Good morning, Mr. Aditya. How are you feeling today? How is the pain?
Morning, Dr. Shivam. I'm alright. The pain has succeeded far more than yesterday.
Oh, that's good, Mr. Aditya. I have my medical student here and he would like to study your fracture example to learn more about fractures.
I'm okay with it.
Thank you. So B, what do you see in the X-ray?
Doctor, I can see there is a fracture in the lower part of the tibia, in the medial malleolus part of the tibia to be exact.
That's right. Can you identify the type of fracture B?
It doesn't look very bad though. I think it's a common stress fracture.
I'm afraid that's not quite right. You should look a little more closer.
Oh, is that wrong? It's not impacted fracture, is it? It doesn't look like the fragments are crushed together.
Yeah, it's not. But can you see that the medial malleolus is slightly out of place?
Oh yes, it's a displaced fracture.
Yes, now you are right. Displaced fractures are always tricky.
Yeah, it may cause permanent disability if you do not realign before it starts healing.
Yeah, the reduction is always important in case of displaced fractures.